Ever been asked to interpret an x-ray and you don't know where to start? Well, follow this simple approach and never be stumped again. It's a really simple mnemonic, doctors A, B, C, D, E. All right, so first up is D for details. Really, you're just making sure, is this the right patient? What's the date and what type of film is this? Next up, R, which stands for ripe. R for rotation. The way you can tell that is look for equal distances between the clavicular heads and the spinous process, which we see here. Inspiration, so count 8 to 10 posterior ribs. 1, 2, 3, 4, 5, 6, 7, 8. We definitely have good inspiration here. P for projection. Is this a PA film or an AP film? Remember, in AP, the heart can appear larger. And then E is for exposure. The way to tell if you have a good exposed film is if you can just see the vertebral bodies through the heart. Next is S for soft tissues and bones. So look for any subcutaneous emphysema. Look at all your bony landmarks, your clavicles, ribs. Is there any fractures? Is there any lesions? Now A is for airway. We can start up here in the trachea and trace it down to the carina and then the bronchi, which should be midline as you see here. Think of your causes and look out for a deviation. Look at your mediastinal width, which should be less than 8 centimeters, and then also look to see if there's any hilar changes. Next is B for breathing, the lungs. First thing I want you to look at is these lung markings, these vascular projections. In particular, look at the edges of the lungs for absent lung markings, right, where it's just black. This may indicate a pneumothorax. The other things I want you to look for is infiltrates or consolidation, and even fluid overload in the fissures or blunting of the costophrenic angles, which may indicate pleural effusion or pulmonary edema. Next up is C for circulation, the heart. I want you to first look at the cardiothoracic ratio, which is the ratio between the cardia of the heart and the thoracic cage, which should be less than 0.5. The other things you can look for is this aortic knob, and then you can look at the borders of the heart and the shape to look for any abnormalities like a boot shape or dilated cardiomyopathy. Next up is D for diaphragm. Now the right hemidiaphragm is actually higher than the left, and this is because of the liver. I want you to look at the costophrenic angles, making sure that those are clear. I want you to notice that on the left side, you're going to see this gastric bubble, which indicates the stomach. And I also want you to look out for air under the diaphragm, which is a bad sign, as this can indicate perforated viscus. And finally, E is for extras. So that's things like various lines, tubes that you might see. So for instance, an endotracheal tube, which would be 2 centimeters above the carina, a